Happy World Diabetes Day 2024. For us at the Maria Holder Diabetes Center for the Caribbean, this represents 10 years as a team of acknowledging and commemorating World Diabetes Day. This year's theme is Breaking Barriers, Bridging Gaps, and there is a worldwide call to ensure that all persons diagnosed with diabetes have access to equitable, comprehensive, affordable, and quality treatment and care. Though we live in an island with a high prevalence rate of diabetes and some healthcare system challenges, we still have an enormous amount to be very grateful for. We live in an island with a healthcare system which, despite its challenges, operates under the principle of equity. We have a government-funded system with some of the best specialists and care providers, a national drug service which has licensed some of the newer tablets, insulins, and pens in a way other Caribbean islands have yet to embrace. However, with freedom always comes some challenge and responsibilities. The staff and board of trustees at the Maria Holder Diabetes Center for the Caribbean is very proud to be a part of the equitable delivery of care, especially with these programs geared towards persons in the polyclinics, on dialysis, and in the phase between late adolescent and young adulthood. We have benefited not only as care providers, but also clients from the generosity of the government and amazing donors who see equitable diabetes care as a must for Barbados. Not only is it care, but it's multidisciplinary care, the gold standard for good diabetes care, where persons benefit from diabetes-specific education by diabetes educators and specialist nurses, to dietetic education or medical nutrition therapy, medical care, podiatry and wound care, eye care services, cardiology, vascular screening, kidney checks, and the list goes on. However, persons should invest in their own care by empowering themselves with knowledge, including nutrition and medication knowledge, then having the discipline and also the commitment to put these in place on a regular basis. While in my lifetime significant drops in diabetes rates may not be seen, what can be attained is a significant reduction in the costly, progressive, and devastating and also unnecessary complications of diabetes through early regular screening for diabetes and its complications, followed by a good legacy of self-care and blood sugar control. Where possible, efforts should be made to put diabetes into remission, especially early in the diagnosis or the pre-diabetic stage. Though I will stress this may not be possible for everyone due to the very nature of diabetes, its genetics, and the highly variable behavior and progression between persons with diabetes. However, I do believe everyone can still optimize their health. I think it's important to remember that diabetes can cause disability, mental distress, and memory decline. Also, challenged populations, whatever the challenge, are more likely to get a new diagnosis of diabetes in their lifetime. But those seen as disadvantaged must never be dismissed, but approached in a way that meets their needs. Persons and children living with type 1 diabetes should never be dismissed or bullied in schools because of their condition, and wider population education should be extended to all persons to better understand these conditions which are prevalent in our society. My core belief is that we all have one life and must live it well. No longer should money or age or educational level be a barrier to education or care, but it must be done in a meaningful and empowering manner relevant to the individual. I urge Barbados, Barbadians, commercial Barbados, NGOs, community and government entities, even entities outside of health, to be a part of the solution for our nation, for our children and the future generation of adults. And I urge persons and their families to also be a part of the solution by taking personal responsibility and living in a way that honors your life and health and that of those you care for. Be your brother's keeper. On every level, the phrase, "what you put in is what you get out," rings true. We remain committed to serving the people of Barbados, and I encourage you to remain committed to yourself. Take care of yourself, empower yourself, and live your best life. We have many resources in Barbados. Reach out if you notice any changes or have challenges. Remember, you are not on this journey alone.